In federal court today, the Department of Corrections and the federal government continue to bump heads on a scheduling agreement outlining when the local agency will be implementing the various policies for medical, dental, and mental care at the prison. And while they disagree on a timeline, in court this morning, Adeloop's announcement on Tuesday of its plan to privatize DepCor's infirmary was discussed at length. Lieutenant Governor Ray Tenorio.
Department of Corrections is not about providing these ancillary but necessary services, including dental or mental health services or even basic health services. We'd like to have a business person come to us, put the professionals together that are required to meet the standards that are needed for all the inmates and detainees at the Department of Corrections and offer it to the government of Guam.
Tenorio says the concept would emulate what the military does with base operations services contracts, where they focus on core competencies, adding that Gov Guam has been spending $2 to $3 million a year.
It seems to me it'd be better to put the liability responsibility to the contract under a private vendor to offer the services of the government of Guam and meet the requirements of the federal authorities.
During the status hearing, DOC's legal counsel Donna Lawrence said the proposal to privatize healthcare services may be possible in 12 months. The feds responded this was the first time they've ever heard about the government's plans for privatization. U.S. Assistant Attorney Jeffrey argued in court that this was just another way for the Department of Corrections to pass the buck for 12 months, kicking the can down the road.
We still ultimately are responsible for the condition of the prisoners and the detainees at the Department of Corrections. We're not passing the buck at all. I mean, you have to be something of a cynic to believe in that way.
The lieutenant governor said they are operating in good faith and that they want to and have to provide the services.
If you look at the federal receivership throughout the government agencies, it's always because the government hasn't done what they're required to do. I think this is a good faith effort on the part of the government of Guam to say that we're going to allow for a private contractor to do it. They're going to be paid to do it.
He stresses that the liability still belongs to Gov Guam and are not passing the buck, but instead assuming responsibility in an intelligent way.
Because what's going to happen now is a company's going to come in, they're going to provide the services, we'll be able to tax them and ultimately hold them liable for making sure that the gauze and the medical conditions and dental conditions and the treatment that they need, even mental services, are there for all the people that need them.
And while the U.S. remains skeptical, District Court Judge Francis Tidingo Gatewood stated the issue of privatization sounds like a good idea, but not sure. We will have to see if it works, adding that the privatization may change the complexion of how to do things. She did express that she was disappointed that there was no joint reporting, stating it is prudent they come together and push the joint proposal through, as they are almost there, almost done with the settlement agreement. And to help things along, Gatewood provided another scheduling date, setting a teleconference between the parties for September 19th at 8 a.m., allowing the U.S. to review the counterproposal. After that, both parties are to submit the joint proposal report by September 26th, identifying what points they agree on and disagree on, adding that she would schedule a hearing to address the disagreements.